everyone, and welcome back to the HeRO Whiteboard. I'm Will King. Today's topic is testing and antibiotic stewardship. There is a lot to discuss, but it's important, so let's jump right in. In the first study we'll examine, researchers analyzed data from the 3,000 patient randomized controlled trial separately based on whether the patient was ever septic on the left or remained well throughout their stay in the NICU on the right. And within those two groups, they compared those patients randomized to HeRO monitoring versus controls. Among the baseline demographics, there were no differences between HeRO and controls in either the septic or non-septic groups. As we turn to outcomes, among the septic patients, we can see that there were significant increases among HeRO monitored patients for days of antibiotics, number of days alive and without mechanical ventilation, survival in the NICU, and survival within 30 days of infection. However, as we turn to patients that were never sick, there were no differences in any of the outcomes measured, including length of stay, days of antibiotics, days alive and without mechanical ventilation, and mortality in the NICU. So, the takeaway from this analysis is that HeRO monitoring allowed clinicians to target the right patients with antibiotics at the right time and save lives in the process without increasing antibiotic burden or in any way altering care for healthy patients. In a recent study, we examined testing and antibiotic usage in the context of the mortality improvement. We noted that HeRO monitored patients spent more days alive, and there was no difference in overall days of antibiotic usage compared with controls. There were small but statistically significant increases in days with a blood culture and days with an unnecessary blood culture. However, since patients must be alive to receive antibiotic or a blood culture, we completed an analysis that controlled for the competing outcome of mortality. And we found that HeRO monitored patients trended toward an improvement in days alive and without antibiotics, as well as days alive and without a positive blood culture. And the improvement for HeRO monitored patients in the number of days alive and without an unnecessary blood culture was statistically significant. Finally, we examined the potential for HeRO monitoring to positively impact antibiotic stewardship in the context of early onset infection. To do so, we analyzed HeRO scores in the 48 hours after a culture was drawn for early onset infection, but before the test result was available. That analysis showed that HeRO scores were higher among patients who eventually had a positive result compared to those whose result remained negative. In fact, patients with high HeRO scores were as much as 7 times more likely to have a positive culture result than those patients with low HeRO scores. And the negative predictive value for a low HeRO score was around 99%. So when we think about infants that are in the NICU and under observation for early onset infection because mom may have had risk factors, but the baby is looking fine and the score is low, there is a real opportunity to reduce the antibiotic burden for these infants. To summarize, overall antibiotic usage was not different for patients randomized to have HeRO monitoring. When separately analyzing the groups that either had sepsis or not, the septic patients received more antibiotics, which was associated with increased survival, while healthy patients had no increased antibiotic exposure. After controlling for the very important competing outcome of increased survival, there was no increase in testing or treatment for HeRO monitored patients. And in fact, the composite outcome of days alive and without unnecessary testing was significantly improved for HeRO monitored patients. Finally, HeRO had a 99% negative predictive value for early onset infection, which offers the opportunity for reduced antibiotic exposure and further improved antibiotic stewardship. References are available on our website at www.heroscore.com/HeRO-publications. We thank you for watching this series on HeRO. If you hit the like and subscribe buttons, you'll be sure not to miss future content as it is released. And please leave comments below or send me feedback directly at wking@heroscore.com. Thanks for joining us, and we'll see you next time at the HeRO Whiteboard.